Welcome to Death Stories Living Truth. I am Janae of Living Truth, a death educator and a storyteller, creating a space where we can finally talk honestly about death, grief, spirituality, and what it truly means to live. On this channel, we explore near-death experiences, real death stories, emotional healing, spiritual perspectives, and the lessons people discover when life changes forever. This is not just a channel, it's a conversation most of the world avoids. And I am so glad you're here, soul travelers.
We would talk about stuff we did when we were growing up and how cool it was that we were working together in the same healthcare space at that time. I got a call from my mom and she said, Amber did something to herself. Because I'm a crisis director and I'm working in a department where we typically see people struggling with mental health issues, working in a hospital, my initial reaction is, okay, what can I do to get into action to help my sister? On my way there, the phone rings and it's the coroner who says, what do you want to do with her body? Because you're the next emergency contact listed. My sister also had a daughter who was 13 years old at the time of her mother's death. And she was the first person to find her mother. And that really stung.
Life is a roller coaster of heartbreak, hope, tragedy, and triumph. Here, we dive into the stories behind the hardest moments and the humans who survive them. Welcome to the Roller Coaster Podcast. My name is Tyler Hall. This community has just exploded, and I want to create a way to bring us all together, regardless of where you're at in the world or where you may live. That's why I created Day by Day Apparel. Every piece of Day by Day Apparel is a reminder that we get through life one day at a time. And if you decide to pick something up, it genuinely helps support the podcast. Click the link in the pinned comment below. Now let's jump into the episode. Thank you. Dr. Marlin, welcome to the Roller Coaster Podcast.
Thanks for having me.
Appreciate you being here. You have a PhD in psychology, and you understand suicide from a clinical standpoint probably as well or better than anybody that I've had the opportunity to talk to. But on December 31st, 2013, you would have a totally different, very personal experience about suicide. So take us back to that day and in detail describe the events of that day, anything useful leading up to that day, and, from the moment that you woke up to the time that you went to bed, what occurred for you on that day?
Wow, thank you for that. I remember very clearly. Obviously, when you have something like that traumatically happen to you, I lost my sister that day, December 31st, and I actually was working as a crisis director, originally from Indiana, and I was at work that afternoon, about 11:30 exactly, and I was at lunch with my boss, my supervisor, kind of talking about the end of the day, had plans to celebrate the new year. It was actually my pastor's birthday, so we had plans to celebrate him. And I got a call from my mom, and she said, Amber did something to herself. And now, mind you, because I'm a crisis director and I'm working in a department where we typically see people struggling with mental health issues, working in a hospital, my initial reaction is, okay, what can I do to get into action to help my sister? Now, mind you, my sister was a nurse. And so she worked in the healthcare space as well. And I knew she had been struggling that year with a lot of life issues, divorce, job, you name it. But at that moment when I got that call, my first reaction was, what can I do to help my sister? So I told my boss, I said, something's up with my sister. I need to go back to my office and find out what's going on. And walked down the hallway, got to my office, got on the phone, and immediately called the emergency room because I was typically used to working with hospitals.
I could not imagine
that's where people were showing
being
up
the director. I'm pretty sure he said he was the director of or he worked as a crisis counselor.
I said, "This is Dr. Rollins."
And knowing that your sister, your loved one, did something to themselves, and to hear your mother screaming in the background, knowing that's your mother, but you're a doctor and you're trying to be professional,
I was like,
and you don't want to panic, but you understand that something has happened that should cause panic.
Jumping through the ropes of that moment, I learned the triage, if you will. I'm sorry, Dr. Rollins. It sounded like there was a.
I could not imagine being the director. I'm pretty sure he said he was the director of or he worked as a crisis counselor, and knowing that your sister, your loved one, did something to themselves, and to hear your mother screaming in the background, knowing that's your mother, but you're a doctor and you're trying to be professional, and you don't want to panic, but you understand that something has happened that should cause panic.
That moment, I learned the charge nurse said, "I'm sorry, Dr. Rollins. It sounds like there was a firearm that was involved." And my heart just dropped at that moment. And I realized that this is more devastating than just simply her doing something to hurt herself. And I went back to my boss's office, and another co-partner of mine who was an executive on our outpatient program was there. And I said, "My sister used a firearm." And I just started to weep. I'd never forget just embracing my boss and my coworker tearfully. And she was like, "You can go, you can go." And so I left work immediately, got to my car, and was just reaching out for anybody to help, quite frankly, of like, okay, I need to get there as soon as possible. And on my way there, the phone rings, and I answer, and it's the coroner who says, "What do you want to do with her body? Because you're the next emergency contact listed." And I somehow got from the hospital to there. I just froze.
Yeah, I thought he said he was
everything
the director.
Else went blank. I just went
and I'm sure there is so much guilt because he's a crisis director.
The end of the year,
and he didn't realize that his sister was in crisis. So much crisis that she took her own life and allowed her 13-year-old daughter to find her. Like, you have to be in a horrible state
just broken
to allow that to happen. Like,
it was my job
to be
so
in so much
crisis
pain
director. We saw
that
people
you
like this every day.
Actually believe that doing this,
I
taking
felt like
your
I had
life,
failed my
is
sister
helping the rest of your family.
To help her in that moment, and I kept asking, "Why didn't you just call me?" Why didn't you just call me? And now, leading up to that, earlier that year, 6 months prior, I had actually admitted my sister to the hospital where I was working as a crisis director, because she had called me one day, and I could tell that she was delusional. She had all this rapid speech, and I was like, "My sister's in trouble. I'm going to go help her out." And I went and got her. She had gotten into an altercation with her ex-husband at the time. They were going through a divorce that was pretty toxic. And she was going through like a psychotic manic episode. And I took her by protocol, took her to her psychologist. We sat down, and the psychologist looked at me like, "She's not okay." And I was like, "I know she's not okay. I need you to make the order to send her to the hospital." And I took her to where I was working, about an hour away. and got her admitted, triaged her, and she spent 10 days in a psychiatric hospital getting stabilized. And backing up a little further, the year prior to that, my sister and I were working in the same hospital back in our hometown. It was Ball Hospital, actually. And I was working in the emergency room. My sister at that time was a healthy, happy nurse triaging patients. She had her own home healthcare business. She worked a night shift, and after I would see patients in the emergency room, I would go up and hang out with her, and we always had a great time. And she was so proud of me, saying, "This is my brother, Dr. Marlin," and we would talk about stuff we did when we were growing up and how cool it was that we were working together in the same healthcare space at that time. And we talked about, she said, "Hey, I got my own home healthcare business. Maybe you and I one day, we can work together. You can be the therapist and I can be the nurse, and we're going to rock this together and help people," which was awesome. I was like, this is so cool. Just that year later, I took a promotion to move to another city away from that organization. And what really struck me as I look back at that moment is the time that my sister ended her life. She was actually in treatment. After she had been discharged from our program, our hospital, she went back to our hometown and she was enrolled in the same community mental health center that I was working for, in the emergency room, front lines, working alongside other nurses and physicians. And I remember thinking back, what was the responsibility of that organization to do differently after my sister died? Did it matter? And during orientation, I started going through my mind this clinical autopsy, if you will, trying to figure out, how did we get from here to here? How did this happen? What was missed? What should I have done differently? And I remember my orientation when I started that job, working in the hospital where my sister was also working. We were the community mental health system that was partnered with the local hospital. And I remember sitting in the boardroom, and the CEO would come in and he would introduce himself to all of the new employees. And you got to ask questions. And I said, "Oh, this is cool."
Wait,
talk to
what?
the CEO, because I was so
There's
passionate
no
about behavioral health. Now,
money
mind
in
you, I had been
prevention?
working in clinical practice, got my
That's
doctorate
so
degree.
sad. And that
And I was excited
explains our
about working in this
healthcare
space.
system.
I had spent
It
some
is
years
about
working in the
money.
school system,
And yeah,
helping kids
that's
who
the only
were
thing that
struggling with
matters
suicidality
is how much money you're gonna
prior
make.
to that. But after
And
I got my doctorate, I
unfortunately,
wanted to do
that's the
something more.
system that we're
And so I
working
found this
with.
job. I sat down with the CEO, with a group of other employees, and I asked them this important question. I said, "Hey, what can we do about prevention of behavioral health and mental health issues?" And I never forget, he said, "There's no money in prevention." And I was like, "What do you mean?" And I sat and I thought about it and I thought about it. And I was like, if there's no money in prevention, then something must be broken here. Something must be off. And I kept going back to that. It's like, is that the belief of the leadership within certain healthcare systems, that it's a waste of time to prevent deterioration of someone's life? I remember calling the director after my sister died. She was my supervisor, and I was like, you could have called me and checked on, my sister was enrolled in your program. It would have been okay for you to just offer. And I asked her, "Are you going to do anything different?" "Well, these things happen. People die by suicide." And I just began at that point to get I was hurt. I was frustrated. I felt like the life of my sister should make a difference somewhere. And I was fortunate because the company that I was working for at that time, because I had a good reputation with my cohort, they knew that the role that I had as a director of operations at the front door of the psychiatric hospital and the front door of this this large mental health provider in the city of Indianapolis. It was important. And the next year, like following that, 2014, we received a grant for $2.4 million. It was a Garrett Lee Smith zero suicide prevention grant that I was working with that company. So they were investing in suicide prevention. And now, mind you, I wasn't ready to just go back to work because I found myself frozen in my own office looking at patients' charts that said suicide, or I was in a meeting that somebody said suicide, and I just felt like somebody just punched me in the heart every time I heard the word. And I worked with nurses everywhere. So anybody who wore scrubs, somebody looked a little bit like my sister, I found myself frozen, like, wow. And I remember when they were making the official announcement, we were in an executive meeting and they were talking to all the directors that next first quarter. And our vice president was standing up about how excited we are about getting this suicide prevention grant and how we're going to roll it out. And she kept saying, suicide is preventable, suicide is preventable. And I'm sitting in the front row listening to this. And it felt like every time she said the word suicide, it felt like somebody threw a dagger across the room, like it just hit me. And I had to get up and leave. And I was in the hallway just bawling. And I realized that I still was hurt by all of this, trying to show up every day, but I wasn't taking care of myself. And a coworker who saw me, actually the same coworker who was there, came to my aid and she gave me the biggest hug, and I just cried and just let it out. And I realized it wasn't something that I could get away from. I couldn't hide suicide. I was in a place where I had to talk about it. So I went to therapy and I did all the therapy stuff, but I also found that even the therapist that I was working with, he was so taken aback by the story. It was like I was just telling him, like, oh my gosh, I can't believe this has happened. This has happened. Like, he was overwhelmed by it. So I didn't feel like he really heard me. He was there listening. He created space for me. But there was also kind of a lack of really understanding of like what to do now. And I didn't know what to do with it. All I know is that it hurt. And it was actually my supervisor who came to me and she said, oh, I see that you're struggling. How are you? Because people typically will come to you and they'll ask you, are you okay? And mind you, this same group of individuals had known my sister because she spent 10 days in that hospital. So everybody felt this sense of responsibility. Everybody knew that she was a nurse. Everybody knew it. And they knew the closeness that we had. So people kind of tiptoe around, but it was something we all knew was important. And what I was struggling with at that point, or what the organization was struggling with, is because we were the behavioral health psychiatric hospital. And we had other med-surg that were different disciplines working on the physical health, oncology, cancer, you name it. And they were trying to roll out now this program called Zero Suicide throughout the entire healthcare system. And nobody was really listening at that time. You know, mental health was not that popular. I called it kind of like the redheaded stepchild. It's like the part of the healthcare that you don't really talk about. It's just like, that's behavioral health. That's one of those people over there. It's not us. And so significant amount of stigma that people were dismissing the importance of mental health and well-being and suicide prevention. So my boss came to me and she just kind of challenged me. She said, when you're ready, you should probably tell this story, because we're having a hard time paying attention to get people to buy into like the importance of suicide prevention. And so I thought about it, and we had a meeting about zero suicide prevention. Everybody had to show up because the CEO of that hospital system made it important. And he said, everybody has to talk about this. We've got this grant. We're going to do something about it. What does it look like throughout all of our healthcare system? Mind you, it's like 7 hospitals. And I remember standing up and telling us, I put my sister's picture on it, and I said, this is my sister. Her name is Amber. She was an amazing nurse. This is what happened to her. She ended her life. And I told the story of our relationship. This is my older sister, just me and her, growing up together. She's 2 years older than me. This is my first babysitter. She's gone, right? And here's the stigma. Here's what we can do. And I started looking around. I saw the other nurses. I saw doctors with tears in their eyes. And I realized, oh, wait a minute. My sister's life has meaning here. This story is important. And that opened up people's hearts and minds to the possibility that, wait a minute, we can do something about that, because suicide prevention belonged in the place of oncology and maternity and cancer and all of these other parts of the healthcare system. People were struggling
from a self-inflicted
right? It wasn't just like those people,
like the kind of trauma,
physicians who
the
were
kind of
struggling
crisis,
with it, nurses that I talked to that come to the crisis department, and I would talk and I would triage to them, and they didn't want to live, and I would say, this is what happened, this is how important your life is. Now, mind you,
that poor baby,
my sister also had
her angels,
a daughter who was 13 years old at the time of her mother's death, and she was the first person to find her mother. And that saying, you know, make sure my daughter's okay. She's a teenage girl now, and I know how I was. And now she didn't talk to me before she passed away, but we had conversations leading up to that. And I knew that this one girl, my sister's daughter, was the most important thing to her. But my sister sent this message to her unintentionally that she wasn't enough in her own view, right? And some people call, people die by suicide, like, oh, how selfish could she be? Like, my sister was in a point where she believed that she was a burden as a mother because she felt like she was not good enough. Things were not working for her. She couldn't get her life back on track. She felt weak. She was struggling with an addiction that was uncovered. And as a nurse, if you struggle with addiction, they'll pull you off. Her license got suspended. She felt like she wasn't herself anymore. The divorce was finalized. She had no nursing
what
job.
They call grief brain,
she was homeless at one
brain
point.
Just kind of,
right. She was a fighter. I'm going to do this. She had hustle.
Capacity is not
right, but
there.
She got to the end of that
so
year.
You literally forget. Like when my daughter was hit by a car, at least 2 weeks, maybe even a month before it happened, I completely lost. I forgot everything. I still, to this day, have no memory of it. And it was about 3 years ago.
And so I spent a lot of time with her daughter, making sure that she was okay, trying to rebuild her. If I asked her today, she wouldn't remember anything that happened for the next 2 or 3 years. It's just kind of like a blank blur for her. Brought her out to speak with her out to speak with me, to tell her story. I had her actually write a chapter in a book that I published, dedicated to my sister, to help her find a voice and platform to make meaning out of it. So those are some of the things that came to light, and so I've made a commitment to do all the work that I'm doing is to honor her. That allows me to have this sense of keeping my sister with me, to do something meaningful with her life, that she's just not gone, but there's something more that needs to be done. Mm-hmm. And I remember then getting involved in the National Suicide Lifeline Steering Committee. And at the time, it was still a 1-800 number, 1-800-273-TALK. And I remember going to the meetings and I would say, if the number was shorter, my sister might have been able to remember a shorter number. And we were still talking at the time in the committee of like, what's the number going to be? And it was called N11. Okay, now it's 988 and it launched in July of 2022. But at the time, I remember even being frustrated with that.
That's amazing. I think that's the most important thing that you can do with your pain and your trauma when you've lost somebody in such a traumatic way, is to reach out and try to help other people who are going to or are experiencing what you've experienced, and give them every tool that helps you. And in doing so, it actually heals you as well as them.
Because it's not something you
so
think
yeah, I think this guy is amazing. And like I said, if you want to watch the full episode, check out At the Roller Coaster Podcast by Tyler Hall, my bad. And yeah, this story is super sad, but super amazing. Like, this man is definitely here for a purpose, and I do believe he's going to save lots of lives. If you are struggling and you need help, definitely reach out. Reach out to all the different hotlines in your city, in your state, and definitely reach out to family and friends and let them know that you need some help. It's okay to ask for help.
Death stories are mirrors. They show us our fears, our regrets, our love, our humanity. And if we are willing to listen closely enough, they teach us how to live differently. Thank you for joining me tonight, Soul Travelers. This is Janae of Living Truth, and this has been Death Stories, Living Truth.